Hello students! Welcome back to English for Nursing. In this session, we are going to learn of how to introduce yourself to your patients. So please remember that this conversation is going to be applicable and you're going to use it in all the treatments when you are giving a treatment to your patients. Do you know why it is crucial for a nurse to introduce herself to patients? Yes, it is to build patients' trust to the nurse as the one who is going to take care of them in the hospital and to highlight the nurse's responsibility for the patient. These 2 points are included in the therapeutic communication, so we should not skip that. So how do nurses introduce themselves into their patients? They introduce themselves by telling their names and then the purpose of the visit. To say this, you can basically say, hello, good morning, or good afternoon. It can be according to the time you come and after that introduce yourself and then the purpose of your visit. So in the whole, you can say, good morning, ma'am. I'm Nurse Sally Brown, but you can just call me Sally. I'll be looking after you this morning. After you introduce yourself, you need to check the patient's identity. You did that to make sure you go to the right patient. To say this, you can say like, can I take your ID band for identity confirmation? And then after that, you can say, can you please say your name and date of birth? Or you can also say, may I know your name and date of birth, ma'am, to confirm your identity? After you check your patient's identity and you make sure that you have got the right patient, now you need to check their health conditions. However, instead of asking how are you today, howdy, what's up, you should ask them how are you feeling today. This specific question asks them directly about their condition. Then your patient is going to respond in highly probability that they are on top of being in pain. To respond this, you need to show the empathic in you. So to respond empathically, you could use 4 steps. The first step is acknowledge. So you want to make sure that you know that your patient is in pain. The expressions could be, I see, I understand how you feel. And then you validate. Validate means that you see there is a pain and you want to make sure where is the locations of the pain. So you say, your back is aching? Which part? And then after you ask that way, you want to normalize and you want to make them feel comfortable and feel that you care about them. Therefore, you normalize. You can basically say, I will do an observation and I'll see if I can do anything for you. But please remember, some patients are not comfortable with you touching them, so please always remember to ask for their permissions. You could always say, is that okay with you? And then finally, to do an encouragement is very important. It means that you are giving them further talk about what they are feeling. So you could say, don't worry too much. I'm going to report to the doctor and let's see if he can do something about that. Lastly, after talking to your patients, you need to tell them that you need to return to your nurse stations. However, ensure to them that you will be accessible. You can basically say, alright, now you can have the rest. I need to go back to the nurse station. If you need me, you can just press the button and I'll come as soon as possible. Now please read this model dialogue. So yeah, after reading the dialogue, you could actually see the expressions that we have just learned before. The nurse goes over the procedural steps, studies first from introducing herself and the purpose of her visit, and then checking the identity of the patients by looking at the ID band, checking health status of the patients, and responding empathically to the patients, as well as leaving the patients. That's a wrap for this session. Remember that good communication is an important part of healing process. So be good to your patients always.